Now, there's a number of benefits from the chiropractic, but I also see the next point, which is ear infections.
Right.
Are another thing that gets benefited by chiropractic.
Right, absolutely.
And you're thinking, well, here's the neck and here's the ear. So how the heck does it go from the neck to the ear?
Where's the connection?
So where's the connection?
And it's funny because a lot of people are really surprised by this. And again, it's unbelievable, the results. It's a matter of drainage. And what happens is with children who get a lot of upper respiratory type infections, a lot of fluid building up, and it's not draining properly. And it's a matter of the eustachian tube, which goes from the middle part of the ear down really into the back of what's called the nasopharynx, kind of the back of the throat. And up to about the age of 5, that tube is more horizontal.
I see.
As you get older, it gets more inferior and it improves the drainage.
Right.
But a lot of it starts with, again, the upper cervical spine. If you have a misalignment of that first and second vertebrae, it puts a lot of tension and well, first of all, it reduces the function of the immune system. Okay, so we correct this to stimulate immune function so that the child is improved immunity and they better fight the infection. But when we correct the subluxation of the upper cervical spine, which we can do very gently, a lot of people, oh my God, it's my child. I don't know if I want the neck adjusted and manipulated. But the thing about chiropractic, it doesn't need to be forceful. It's very specific, very gentle. It's a quick thrust. You don't necessarily need the popping and cracking. And in children, a lot of times, that's the way we do it, very, very gently. But when you manipulate those bones and then work with a lot of the soft tissue, if you look at an anatomy book, there are small little muscles that are very closely related to these upper cervical vertebrae. And they attach to that opening, very close to the opening of that eustachian tube. And when we start manipulating and mobilizing those vertebrae, it affects those muscles, loosens them up, and allows drainage. And there's also a lot of drainage techniques. And I can't tell you the amount of children that I've worked with that have been on antibiotics their entire lives. Once we start adjusting them and working with them, and the number of visits varies depending on their overall health and well-being, but I would say 9 out of 10 children that I've worked with, we've gotten proper drainage. I mean, for an example, I had a family
they've gotten off the...
Absolutely,
yeah.
Absolutely. And then we work nutritionally and say, these types of things might cause some inflammation and fluid, so that helps as well. But I can't tell you how many children. Like today, I had a 7-year-old in, and his mother was telling me, this is the first winter that he's never needed an antibiotic. And not only that, but it's the first winter he's not had an ear infection. And boy, when you do that, you're getting these children off these medications. Again, it's not that medication's bad. We just want to limit how much they're used. And with the antibiotics,
when they really need it, they're not going to work.
Exactly.
So
exactly.
It's better to take care of something that you can take care of this way than have it, 5 years down the road or whatever, not have it work because he's had too much.
It's a big problem in the hospitals today. So, but it's you hope that things are going more in a natural direction.